is a thing in your body that is a congenital malformation. That is, it's called an AVM, an arteriovenous malformation. That's where you have an artery connected directly to a vein without first going through a capillary bed. One of the things that a capillary bed does is that it takes off the pressure of the arterial side. But if you have an artery going directly into a vein without going through that capillary bed, that pressure is transmitted to the vein, and it will become engorged and dilated. That's what's happened in a varicocele. In a varicocele, the testicular artery, there's an AVM between the testicular artery and the pampiniform plexus without it first going through the capillaries of the testicles. You wind up with these swollen, enlarged pampiniform veins, and it feels like, I mean, the classic term, if you ever hear, if somebody ever says to you, bag of worms, the answer is a varicocele. And that's exactly what it looks like, and that's what it feels like when you put your hands on it. It feels like a bag of worms.
Is it common?
Huh?
Is this pretty common?
Maybe like a tenth of the population or something. I've seen it several times. The problem is it messes up the regulation of temperature in the testicle, and unless it's fixed, this testicle will typically be fertile. If it's bilateral, the patient will be. So, the way you do.
What, unilateral usually?
What's that?
Unilateral usually or bilateral?
I've seen them both. Probably unilateral is more common. I don't know, I'm guessing at that.
You said fertile, but you mean sterile?
Do you mean sterile?
Sterile,
Okay.
or that's, I
It says
meant
fertile.
infertile.
Yeah.
Okay.
There was a guy, years and years ago, he was a medical student that he was a football player at OSU, Oklahoma State, played football for Oklahoma State. And there were two women while he was a football player that accused him of being the father, baby daddy of their baby. And so when he got into medical school over at the Health Sciences Center, he sold body parts like crazy to finance his way through medical school. I mean, he did bone marrows, he did all these studies for the psychiatrist, where you take Valium and drink liquor and then do all these reaction time studies. Like you need somebody to actually research that. I can tell you, it will screw up your reaction time. Anyway, they started offering bucks for sperm donations, for their genetic research. So he goes over there and gives a sample and, gets it $50. It was $50 per visit. And so you could go up 3 times a week. For him, that was like fuego. I mean, so anyway, he goes over there and gives a couple of samples during the week, and then he gets ready to go later on the next week, and they told him not to come back because he was sterile. It turns out, so he goes to his doctor's office or somewhere. Turns out he had bilateral varicocele. And it cost him about $6,000 for the surgery to get him fixed. So there were two morals of the story. One is he used up all of the money he made selling body parts to fix the one body part that was bad. And two, he was not the baby daddy of those two babies up in Stillwater. So anyway.
What do they do to fix that?
I don't know. They probably go in there and strip the veins.
Is it something that's like continuously, like, could he have been sterile before and then like acquired this?
No, this is a congenital thing. This is not something you can acquire. You're born with it.
But after the repair surgery, would he then be fertile?
It depends. If the germ cells in his testicle had died, then he would be completely sterile. If they are able to regenerate it and start producing sperm. Now that the temperature is normal, he might, but given the fact that he was in his 20s, late 20s, he was probably sterile. He still doesn't have any children, I know that. He's married, and I know he doesn't have any children, so maybe he is.
Why didn't he go to the doctor when he noticed that he had a bag of condoms?
He didn't notice that. He didn't notice that.
Well, if you had heard.
I mean, we don't all walk around holding our scrotum.
Yeah, you
What's that?
He said like he had it his whole life, so it's not abnormal.
Right, yeah.
Well, it still feels like a bag of worms.
That's what
We
they
probably
were.
have another guy.
He would have seen other people play football.
Y'all wanna call him and ask him?
Yeah.
All right, let's go on to something else. Inguinal hernias, there are two types of inguinal hernias. An inguinal hernia is when the abdominal contents, it can be the fat of the abdomen or the intestines even of the abdomen, herniates through the abdominal wall and descends into one of these rings, either the superficial or deep ring. This one over here, and this little spot right there on this slide, represents the inferior epigastric artery. That line right there represents the deep ring, and remember that continuous line, that's the pathway of the testicle. A direct, let's do the indirect first, because it's easier to understand. An indirect inguinal hernia occurs when the abdomen, the intestines, goes through the deep ring along that line. It opens up that line essentially, and it can descend into the scrotum. That's an indirect inguinal hernia, and it's called that basically because it gets into the scrotum by having to go start out here. It leaves the abdominal wall lateral to the inferior epigastric artery through the deep ring, travels down, it can travel down the inguinal canal and then into the scrotum. So that would be the inguinal canal right there, represented the inguinal canal. That's the superficial ring, that's the deep ring. So it originates outside of Hasselbalch's triangle. Hasselbalch's triangle would be between the artery and the rectus abdominis muscle. Conversely, over here, and these are usually congenital, a direct inguinal hernia comes straight through the superficial ring. It does not go through the canal. It does not originate lateral to the inferior epigastric artery. It originates in Hasselbalch's triangle. These are quite frequent. They produce pain in the area, especially lifting something. You increase the abdominal pressure, intra-abdominal pressure, and it tends to push the intestines down. Patients will say they feel a bulge right in here. Especially if they lift something, there's a bulge, there's a prominent bulge on physical exam. What you want to do is you want to take your little finger, and if this is the scrotum, you push up through the scrotum, you push up with your little finger, and you push it into the superficial ring. Put your finger in the superficial ring, and have the patient bear down, and then if there's intestines, you'll feel the intestines bump onto your finger. Okay? That's the way when it happens, they'll say that's painful. You most likely have an inguinal hernia. You take them to the OR, and in the OR is when they can determine for sure whether it's direct or indirect. So, you guys, you can go home tonight and feel your spermatic cord. You can feel it. You can put your finger up into your superficial ring. The vas deferens feels like a very hard rope. It's very distinct. You won't miss it. When you get your spermatic cord, like in your top of your scrotum, you feel it through the spermatic. You feel the vas deferens through the spermatic cord. You'll know you got it. today in lab, you'll feel it, it feels like a rope, okay? You women, find a guy, put your finger into his superficial ring. You can push it up in there quite far, actually. You can push it if he's relaxed enough, if you give him enough wine, whatever. Your finger all over, halfway down the inguinal canal. Halfway down the inguinal canal. You can actually feel the pulse of the testicular artery in the canal if you get a cooperative person. If he's not cooperative, just grab hold of him and hold still.
Can't the testicle actually go back up in the superficial canal?
Can a testicle go back up in the superficial canal?
Why don't you try it?
If you pull your tongue real hard, you can pull it back up. No, it can't. This should be closed. I mean, you can try to massage it up next to it, but I don't think you can pack it back unless you got a small testicle and a big superficial ring.
Okay, I was in with the physician on a patient who I thought they said that his testicle had gone up into his inguinal area.
Well, now, in newborns especially,
No, this was like an old man.
you know, it might be able to, I don't know. Again, small testicles, big rings, who knows what can happen. In newborns, the one thing you always check for in a newborn exam is you want to check for a cleft palate. You want to check you got 10 fingers, 10 toes. You want to make sure that you've got 2 testicles in the scrotum. Because they can be born with their testicles up in the canal or even up in their abdomen. That's called cryptorchidism. C-R-Y-P-T. Orchid is the name, is the Latin term for a testicle. Cryptorchidism. That actually has a higher incidence of testicular cancer. Developing, if you don't fix it, if you don't pull the testicle out of the canal and into the scrotum, it has a higher incidence of testicular cancer. Those people.
But can a guy be born with just one testicle and not, or does it have to be?
I imagine you could be born with one testicle. It'd be highly unusual, I think. I've never known a testicle to be in the abdomen. I've seen cases of cryptorchidism in newborns, but not, it's descended down to here. I mean, this is such a bizarre area. When I was a student, I had a patient at Topeka VA hospital, it was a psych hospital, and these patients were just nuts. He had a hernia. Note that the indirect hernia is most likely to go into the scrotum. So he was lying there in bed, and I was doing physical on him. And I got down to his hernia exam, and his scrotum was about that big. It was huge. And I was looking at it for a second. I said, well, that's strange, because the scrotum was sitting there moving. It was peristalsis from his intestines inside the scrotum. So I said, hey, that's cool. So I put my stethoscope on, and put my stethoscope on the scrotum, and you can hear bowel sounds in the scrotum. I said, hey, that's cool. So I took his intestines, and I massaged them back up into the canal. So now his scrotum was normal size. And I said, bear down. And he did that. And I sat there and played. I pushed him all back up there. And I called. So,
You're kidding.
no, I'm not kidding. I'm not kidding.
You did it that way.
I
You
could
massaged
probably
him back
take
in
you to
there?
the bed the guy was lying in. It was that remarkable to me that, I mean, first I saw it, and Those are peristaltic waves. This is gonna be fun.
So you push back into, like, so you're massaging and you're pushing the intestines back up into, like, what you're,
Where you're pushing the intestines back up through there into the abdominal cavity. And his defect was so large, he could just, like that, and it would just explode. Remember that guy over at Good Shepherd? He had a ventral hernia that, I mean, he had this thing, his intestines were essentially herniated outside of the abdominal wall. He had this big bag of hernia over here. It was an umbilical hernia. It was crazy.
It wasn't, he just lives like that, it's just,
Huh?
he just like lives like that.
Yeah,
He's a Walmart.
yeah, he'd love for the students to come in and get their hands on it, you know, just push it around.
Was it not painful?
No.
It's crazy that that's.
Oh, this guy, the guy with the scrotum, or this
The
guy?
scrotum guy.
I don't think so.
It's crazy that that doesn't get obstructed. Like,
Well, now, if it does, if the stricture is too narrow there and you get intestines through it, and it cuts off the blood supply to the distal thing, that's called a strangulated hernia. That's a medical emergency, because you gotta reduce it. When you take the hernial contents and push it back to where they're supposed to be, that's called reducing a hernia. If it won't reduce, you gotta take it to the OR, or if it's strangulated, you gotta take it to the OR. Here's an example of what we're talking about here. Here's a direct inguinal hernia, pushes right through the superficial ring. Indirect comes down the canal. Okay. McBurney's point, we will talk about later on next week when we get to the appendix. I'm not going to talk about it today, but realize that it's the point midway between the umbilicus and the ASIS. Skin that grows too big too fast. It produces these areas called stria. This is what you commonly see in the third trimester of pregnancy. This is what you see in people with ascites, with a big rotund abdomen. In pregnancy, due to the presence of a hormone here that's released by the placenta, the collagen, the linea nigra, the linea alba, becomes darkened, and it becomes a dark line. It's called the linea nigra. 99.9% of pregnant women in the third trimester will get a linea nigra. After you deliver the baby, it goes away. It goes back to invisible. Women will get stretch marks with childbirth. You guys, there's a stuff, believe it or not, called belly butter. It contains vitamin E and other things that they will tell you to rub on them to reduce the incidence of stretch marks. You just do it, keep your mouth shut, just do it, okay? Stephen, you're shaking your head, just do it. If they tell you 2 o'clock in the morning they want pickles and chocolate chip ice cream, get off your ass. Don't argue with them, don't say anything. If they tell you to rub belly butter on their belly, you put that nasty stuff on your hands and you rub it on your hands. Okay? Don't ask, just keep your mouth shut. Two things here. The tunica vaginalis can fill up with fluid and produce what's called a hydrocele, a water-filled bag in front of the testicle. You actually can transilluminate it. You get a light source and you shine below it, and you see here it transilluminates it. It's pretty remarkable. These things can get pretty large, and they're definitely different than a varicocele. You won't mix these up when you actually see one. But they'll come in and say, hey, something's going on down here, and it's like maybe the size of a ping pong ball, a tennis ball, something like that. And it's just fluid. You really don't do anything about it unless it becomes painful to them. Otherwise, just leave it. This over here, though, is called Hematocele. This is the same tunica vaginalis, but this guy got kicked in the noo-noos, and this is blood in the tunica vaginalis. This can form a hard clot if it's not drained. So, it's a funny story. A friend of mine, Bill, he and his wife, we played racquetball a lot back in the day, and he and his wife trying to get pregnant, and they couldn't get pregnant, so they went through the infertility thing. They already spent $10,000, still couldn't get pregnant, so he and I went to play racquetball one night. So he made a mistake of going in front of me like that, and I took that racquetball off the back wall and went through his legs and hit his anatomical ball sack, a racquetball going 500 miles an hour in his noo-noos. So today, he has problems with his, one side is like this big from the hematocele, it's clotted up, the other side is normal. But a month later, his wife's pregnant. I'm quite certain it's because I dislodged all of those sperm. He's a rotation site for us, he'll be lecturing to you. And so ask him about his testimony. Ask him what I did for him to get his daughter.
Did they name the child after you?
No, but if you want to talk to him, I'll get him on the phone.
How many children does he have now?
He has 2 now. It was just, I'm telling you, it was like clogged up or something. It just took rattling those things. You know those clackers they used to have? Plexiglass balls? You know what I'm talking about? No, you don't. Testicular torsion, and there is an ovarian torsion that happens when, in guys, the gubernaculum detaches. It degenerates. So the testicle is not anchored to the bottom of the scrotum. It's free to rotate. And during vigorous exercise, if it does rotate, it can strangulate or block, cut off the blood supply through the testicular artery. This produces an acute, sudden pain, and if it's not corrected within a couple of hours, you'll wind up with a necrotic testicle. Very serious medical emergency. There's also, as I said, an ovarian torsion. One of the things I missed in my career is I thought she had appendicitis, sent her to the OR, and the surgeon came back and said, no, here's a picture of her appendix, and it was a beautiful appendix. And I said, God, I swear it was appendicitis. Turned out she had ovarian torsion. So regardless, sending her to the OR was the right thing to do, just for the wrong reason. What?
How's it happen, like, for like, you don't get it from like activity, like the ovarian torsion, like, how does that happen?
I don't know. She was in bed when it happened. It was like 6 o'clock in the morning when it happened.
Would you have like a white blood cell count or anything?
Were you watching?
Would you have like a white blood cell count?
You do. You have a white blood cell count goes way up, about 18,000. Normal is 4,000 with this kind of thing. But it goes up not so much because of the process here. It goes up because of the pain. And the ischemia will cause it to go up after a few hours. Here's the thing, if you're in a situation, and most of the time this happens to teenage boys. Here's the thing, if it happens and you're out on some camping trip or something, miles and miles or hours and hours away from health care, if they complain, sudden sharp pain in the testicle, then what you do is you take the testicle and you spin it. If you spin it the wrong way, if you twist it that way, it's going to continue to cause pain. If you turn it that way, it's immediate relief. So if you're in a place where you don't have a Doppler ultrasound and you don't have a surgeon, spin the testicle. Okay.
Does that just temporarily relieve the pain?
Well, in order to fix this, they spin it. That's all it is. You spin it in the OR, and then you tack the testicle down so it doesn't happen again. If you don't do it, if you don't tack it down, it will happen again. This is an umbilical hernia, big, huge hernia right here. The umbilical cord, this is what it looks like after you're a newborn. That's the umbilical cord. That's an umbilical cord clamp. You have about 1.5 inches of cord. A lot of babies will have this little hernia right there. 99.9% of the time, it will come back in before they reach kindergarten. But you'll have a lot of parents bring their kid in, all worried about this umbilical hernia. Nothing to worry about. You just reassure the parent it'll go away over time. One of the weird things is in the African American culture, a lot of times they'll tape a silver dollar or something to it. They'll push it back in and tape a silver dollar to it to make sure it goes back in, but you don't have to do that. Any questions?
Do undescended testicles usually go with umbilical hernias?
Not that I'm aware of.
Okay.
Two separate processes. Anything?
So in an adult, does that have to be like a complete rupture of the linea alba or something?
Yeah, as a matter of fact, one other thing I should tell you about is that in some people, the linea alba is not intact, it's separate. So when if they're lying down and they lift their head up, they'll have a ridge right here, okay? That's called a diastasis, diastasis, recti, diastasis recti. And that's I'm not sure it's what you call it normal, but you see it quite frequently. I actually have one. It's not prominent, but it's there. You can feel it when I'm lying down, I lift my head up. You can feel it. You can put your fingers through the rectus muscles.
So that's because it's not fused?
It's not fused, yeah.
What's not fused, I'm sorry, the
At the linea alba.
linear.
Okay? Anything else? All right, so today in lab, this afternoon in lab, you want to take the campers and scarpus fascia off. You want to see the different abdominal muscle layers. You want to define the rectus sheath. You want to look at the spermatic cord. You want to understand the inguinal region. Feel and then open the spermatic cord. You can see the pampiniform plexus. Find the testicular artery. Find the vas deferens. Okay?